Doctor, I hope you're doing good. So let's just evaluate your letter. Okay, this is fine. Lisa Smith, endocrinologist. Okay, this is also okay. Dear Dr. Smith, that's fine. Mrs. Priya Sharma, date of birth. You can definitely write this way, no problem so far. I'm writing to refer Mrs. Sharma, who has a poor glycemic control despite adjustment in her medication for further specialist assessment and management of her glucose level. Uh, you can just put a full stop over here despite adjustment in her medication. Okay, and then you can write your further assessment and management, or your further specialist assessment and management would be of her glucose levels would be appreciated. That would be more better and compound purpose. Okay, but this is also okay, but that would be much better. Okay, let's move forward. Okay, Mrs. Sharma has been diagnosed with type 2 diabetes since 1999, for which she takes metformin and glipizide. Her family history is positive for type 2 diabetes. Okay, well, no problem. Initially on this date, Mrs. Sharma presented with a complaint of elevated glucose level up to 6 to 18. However, her appetite, bowel movement, and micturition were normal. Additionally, her full physical examination was normal apart from blood pressure of 155/100. As a result, relevant investigations were ordered. Consequently, candesartan 4 mg, 1 in morning for commence. 1 in morning was commenced. Okay. Just write consequently candesartan 4 mg in the morning, or just write was prescribed. Okay, you can skip it morning and stuff like that. Okay, and this is not for it's was commenced. On subsequent visits, Mrs. Sharma's reports were reviewed. Her investigation showed elevated HbA1c up to 10% and elevated cholesterol level up to 6.2. Based on these results, metformin see, metformin is a generic name, so you will write small letters. Okay, small m should be there. Okay, was changed from 500 mg to 750 mg. Okay, fine, no problem. You can write this way. Atorvastatin 20 mg and glipizide 5 mg in the morning. See, you don't need to write in the morning, in the evening, BD, OD, these sort of things. You can just simply write change to 500 mg to 750 mg. Okay, or if you want to write like you have twice a day, then you can just write simply B and D. Okay, rather than writing it twice a day, the whole word. Because you have limited word count, so you have to use it wisely. Okay, and you can skip it this morning and evening, and etc. etc. Okay, let's move to the next paragraph. On her follow-up visit, her pathology report of cholesterol came within normal range. However, now the problem over here is, first of all, this you can write till here, the prescribed, and then you can skip this one, because these are the reports. There are 2-line visit that was given over there, which shows fine findings. You can skip it, no problem. Now you have to start a new paragraph for today's visit, because this 16 plus range and 7, this is a today's visit. Okay, so you have to write today. Mrs. Sharma's results have been reviewed. which has showed fasting sugars of 16 plus, and random sugars or other blood sugars are in 7 to 8 range. Okay, so that is a today's visit. It should be written separate. Now the problem is, in this letter you have not written a today's word and today's visit separately, so you will not be able to pass the letter because you have missed the most important visit of the letter. Okay. So just think about it. In view of the above, I would believe she needs your expertise to manage her sugar levels. I would be if you could see, just you can just concludes till here. There's no need to write the next line if you want to write this way. Okay. So your conclusion is fine till her sugar levels. Okay, you don't need to write I would be grateful if you could manage, because you are writing this thing in the purpose where you have to be grateful. If you have any queries, you are sincerely okay. So but all other things are fine, I would say. Yeah. Now, just because you have lost the most important visit, things are a bit messy, so I'll give you 300 for this one. Okay, overall your letter was fine, but unfortunately you missed the important thing. Thank you so much. I'll see you inshallah in the next lecture.